So I have been diagnosed with a glioblastoma grade 4, which I believe is the ugliest of all ugly. The average life expectancy is 14 months and I'm already at 7.
My name's Paul. I'm Angie's partner of 15 years. I'm retired. I'm enjoying living in Australia and France. We spend our time 50-50 between the two, continuing to do all the things we love, mainly outdoors, riding bikes, walking in the mountains or around the beaches, and travelling.
I was on a cycle, I think about the 29th of August with 2 French friends when we stopped for coffee and croissant, as we usually did, and I started feeling a weird electricity in my hand and a numbness in my mouth. I said, get an ambulance, so they did. I woke up in neurointensive care in Carcassonne Hospital, which is about an hour from where I was, not remembering the last 4 or 5 hours. So there I was, a patient. It had appeared I'd had a massive epileptic fit in the ambulance, and from an MRI there was some inflammation on my brain. So I spent some time there, had more tests, and they did determine it was a tumour. The surgeon said, and we'll make an appointment for early next week and start you on chemo and radio. So they released me and sent me home, and the middle of next week we still hadn't heard.
When we got the timetable, it was like, something like, I think the oncology appointment was 6 weeks out. I didn't feel that timeline met the seriousness of the diagnosis. It just didn't make sense to me. But with the serious effects of COVID, it really had a major effect on the resources at hospitals in France. So I sort of got to understand that these timetables were not normal. And I knew intuitively and instinctively that we had to get home.
We got to Paris airport, there was nobody there, nobody. And then it sort of hit, this is COVID, we're getting on a big plane and I don't know what'll happen with my brain. When we landed in Sydney, the airport was deserted. We were temperature checked and then we were funneled off to talk to a nurse. I had the most wonderful, empathetic, beautiful person talk to me. I burst into tears immediately, sobbing, saying, I thought I was going to go home and I don't know what's happening. I've been diagnosed with a brain tumour. I have no idea what's going on. She was wonderful, absolutely wonderful.
It was almost, it was like a handover. It really, I felt like I'd almost passed a relay baton across, because I had Angie's hand almost for the whole 24 hours of that flight. She was terrified. And as a result of her being terrified, of course I was terrified, although I was trying not to show it. But I really felt from the time we walked into that airport, we were immediately in this care. We went from this beautiful receiving nurse to doctor to COVID testing to hotel allocation.
We were taken to the Meriton Zetland Hotel. We were shown to a room which was a suite. It was just a huge relief to know we had somewhere to spread out for 2 weeks, have sunshine, sit in the sun on the balcony and just have our own space, which I still needed. During the time I had, I think, 3 new and different types of seizures that scared me and scared Paul. But we had 24-hour access to a nurse who then took all the details and said, I'm ringing RPA virtual to talk to a doctor. The doctor then rang and spoke to a neurologist, which was just very reassuring. I mean, Paul and I had no idea what was happening to my body and how quickly things could deteriorate, but just knowing that they were there 24 hours a day, the nursing staff were checking 3 times a day, it just made such a huge difference.
That was, for me, the biggest thing, and the pressure just lifted off my shoulders straight away, because I was not able to have that immediacy of care in France. Since I've been in Australia, from the moment we walked into the health hotel, it's been, I can get to medical assistance immediately,
They managed to get an appointment straight away with a neurosurgeon for the day we got out. So after the reassurance we had in this security blanket of the health hotel, we knew we were going straight into someone else's hands. So there really wasn't a moment of feeling vulnerable. Luckily my chemo is at home. It's pill form because of the blood-brain barrier, which is fantastic. It's not making me nauseous, so I'm eternally thankful for that. I'm doing everything I can.
I think we're still at the beginning, you know, really. But I feel now that we've connected with the right people who are giving us the right advice. So I think as long as we can maintain some level of normalcy, we can meet our friends and family and spend time with them. And if we can do all of that and be tracking along a medical path, which at the moment we feel is the best we can have, then that's all we can do.
Every time I speak to the oncologist, she's just said to me, stop trying to put yourself in a box and label yourself, just keep doing what you're doing. So I'm pushing myself and trying to live every day.